In this video, we're going to demonstrate passive range of motion for the hip. First, we're going to start with hip flexion. So you're going to take the patient's leg. Now you can keep it underneath like so, especially if it's a heavier leg or you're having a tough time moving it, and close to your body. That way you'll be able to use your body instead of having to use a lot of your arms. So taking them through hip flexion. You can also do AB adduction in supine. So this is AB adduction, moving away from midline, AD adduction toward midline. You can assess external and internal rotation of the hip at 90 degrees of hip flexion. So firstly, starting with external rotation and then moving into internal rotation. Now, if you wanted to assess external internal rotation in prone with the hip at neutral, you can have the patient lay prone. A good way to compare internal rotation side to side, if you move the legs close together, stand at the base of the table, flex the knees, and then provide internal rotation like so, and you can look to see any asymmetry side to side. For external rotation, you're going to want to block the pelvis and move into external rotation, assessing for end field. And finally, for hip extension, you have the patient just move a little bit closer to you. This can be done either with the knee flexed or extended. So if I start with the knee extended, I'm going to come underneath the thigh, just proximal to the knee. Again, I'm going to block at the pelvis and then assess hip extension. The same thing can be done with the knee flexed to look for rectus femoris involvement as well. And that is passive range of motion for the hip.